Assalamu alaikum wa rahmatullahi wa barakatuh. We will continue our talk about symptomatology in urology. In this part, we are going to talk about lower urinary tract symptoms. Now, the lower urinary tract symptoms as a term is a non-specific term. It has been used as a general term to refer to any combinations of urinary symptoms, or to be more specific, it was used to indicate the overactive bladder, what is known now as overactive bladder symptoms like frequency, urgency, and nocturia. Later on, lower urinary tract symptoms was defined to be symptoms relating to storage and or voiding disturbances that are common among aging males and females, of course. So lower urinary tract symptoms are symptoms associated with urinary bladder because the urinary bladder has the function of storage and voiding. So they are related to the urinary bladder and its outlet. And as we have said in a previous video, bladder outlet includes the bladder neck, the urethra, and the meatus. Now, lower urinary tract symptoms are categorized as symptoms related to storage, as we have said, or symptoms related to voiding. Sometimes also symptoms that happens after post-micturition, but those are mainly obstructive or it's failure in the voiding stage rather than in the storage phase. So symptoms, we will talk now about voiding symptoms, which are problems that happens during the voiding stage and what is known more as obstructive symptoms. So the term obstructive is much more commonly used by people or urologists in the field. And the more correct term is voiding symptoms because the voiding symptoms can happen without having obstruction. It can happen with weak bladder. So weaker contractions can looks like an obstruction. Now the symptoms are related to stages of voiding at the beginning or before starting urination. Hesitancy may occur, which is difficulty in initiating micturition and will result in delay in the onset of voiding after the individual is ready to pass urine. Typically, micturition occurs a second after urinary sphincter relaxes. However, in men with bladder outlet obstruction, this will be prolonged or delayed a little bit. Also, straining to void may occur at the beginning, which straining is the use of abdominal muscular effort to initiate the stream or to maintain it or to improve it if it is weak. So straining refers generally to use for any Valsalva maneuver, either abdominal muscular contraction or manual abdominal compression by the patient, what we call it Crede voiding or Crede maneuver, to help push the urine out. Thereafter, after the starting of the urine, the stream may be slow or weak, and the individual's perception of reduced urine flow is the main concern, because usually we compare the status or the performance of the patient now with that when he was better or doing better, or to compare it with other males using Euroflow studies. Also, during voiding or the stream of voiding, we can ask about a splitting of the stream or spraying of the stream. That may indicate also different types of obstructing objects in the stream, in the urethra. Now, intermittency or intermittent stream is when the urine flow stops and starts again, one or more occasions. It is not important how many times during micturition, and it indicates either severe obstruction or an object that obstructs and opens again. Now, regarding the dribbling, dribbling also is associated with obstructive symptoms or weak pushing of the bladder. So, a prolongation of the final part of micturition is called terminal dribbling, while if the dribbling happens after completion of voiding or going outside the bathroom, this is what we call it post-void dribbling. It's more annoying to the patient and more significant and making more discomfort. Also, a sensation of incomplete evacuation or incomplete emptying can happen with obstructive symptoms due to residual urines inside the bladder because of obstruction or because the bladder is not pushing enough for complete voiding to happen. Now, causes of lower urinary tract obstruction includes, of course, most commonly the benign prostatic hyperplasia in males. Also, of course, prostate cancer can be obstructive and causing obstruction. In the urethral stricture disease is the commonest. Also, dysfunctional voiding and detrusal external sphincter dyssynergia, which are part of a neurogenic bladder, can cause obstruction. Severe phimosis and severe meatal stenosis at the meatus can cause obstruction. Now, I know that if the obstruction is acute, we call it acute urine retention, which is inability to void at all, and there will be a lower abdominal distension in the bladder and pain. But most of the cases, it is a chronic obstruction, so it is partial obstruction. It is not complete, and this is a chronic obstruction. We can call it, of course, obstructive lots, and the sensation of incomplete emptying means that we may have a post-void urine residue, and this will result in a frequency which is more frequent urination, more frequent than 2 hours, every 2 hours, or more than 5 to 6 times per day. And it is relative actually, because if the patient reported increase in frequency, this means frequency, but in obstructive scenarios, the frequency is due to large post-void urine residues inside the bladder. Now, in patients also with weak detrusal muscle activity, even with minimally obstructive outlet, so the outlet is maybe normal or with little obstruction, they will ends up with obstructive symptoms and maybe chronic urine retention or even acute urine retention in some cases. That's why it's important to consider causes for hypocontractile bladder or acontractile bladder when evaluating patients with obstructive symptoms. Now, chronic obstruction also, if it is lasting for, let's say, months or very long standing obstruction, this can cause a reflexive, let's say, muscular hypertrophy in the detrusor muscle and increase in collagen laydown and bladder fibrosis, and this will ends up in irritative voiding symptoms, which is that's why LOTS is vague term and the symptoms are mixed. So people with a chronic obstruction and long-standing obstruction will have irritative voiding symptoms or failure to store at the end. And also in the last video we have said that also lower vesicourethral stones can result in irritation to the detrusor muscle, resulting in irritative voiding symptoms. Thank you for listening for this part. We will talk about irritative urinary tract symptoms in the next video.